You've definitely heard the term PTSD thrown around, but what does it actually mean, clinically speaking? Well, today we're going to pull back the curtain. We're using a clinical guide written for doctors to really unpack post-traumatic stress disorder. Think of this as us translating the expert-level stuff into a clear, understandable explainer for all of us.
So here's our game plan. First, we'll nail down exactly what PTSD is. Then, we'll get into the 4 core symptoms that doctors look for. After that, we'll talk about how they spot the more subtle signs, and then, the most hopeful part, we'll explore the paths to treatment and managing the condition.
All right, so let's start with the basics. What are we really talking about when we say PTSD? The term gets used pretty loosely, but from a clinical point of view, it's incredibly specific. It is way, way more than just feeling stressed out after a bad experience. Right, so the clinical guide we're using defines PTSD as a complex and diagnosable disorder. Now, the key phrase here is extremely threatening or catastrophic events. This isn't just about stress. And another crucial point, anyone, and I mean anyone, can potentially develop it.
Okay, check this out, because this is where it gets really interesting. You look at the general population, and it's about 1%. But then, wow, a study found that in a typical doctor's waiting room, that number could be as high as 15%. And for high-risk groups, it can rocket up to 50%. It just goes to show you how often this condition is likely hiding in plain sight.
So when we say high-risk groups, who are we talking about? Well, some are what you might expect. Refugees from conflict zones, soldiers, police, first responders. But it also includes victims of disasters, accidents, or abuse. The guide also notes that having a pre-existing mental illness can be a risk factor. And it's so important to remember this. Trauma can ripple out and affect close family members too, including kids.
Okay, so now we know what it is and who it affects. But how do doctors actually identify it? Well, they look for 4 very specific groups of symptoms. You can think of these as the 4 pillars that have to be there to make a diagnosis. Now, this is a really key takeaway. A PTSD diagnosis is never based on a single feeling. It's about a persistent pattern that includes all 4 of these things. You have the initial traumatic event, then you have the constant re-experiencing of it, the active avoidance of anything that reminds you of it, and finally, this state of being on constant high alert. All 4 have to be in place. Let's dig into that second pillar, re-experiencing. This is so much more than just having bad memories. This is the trauma literally invading the present moment. It can be through intrusive thoughts that you can't control, vivid flashbacks where you feel like you're right back there, nightmares, or just this intense physical and emotional distress when you're reminded of the event. So to cope with all that re-experiencing, the third pillar comes in, avoidance. This is a person actively trying to control the chaos. They might try to push away thoughts or feelings. They might start avoiding people or places or activities that act as triggers. And while it's a survival tactic, as the guide points out, it often just leads to social isolation. It can make a person's entire world shrink.
And this brings us to the 4th pillar, hyperarousal. The best way to think about this? Imagine your body's internal alarm system gets jammed and is stuck in the on position. That's what this is. It shows up as things like serious trouble sleeping, being irritable, not being able to concentrate, always being on guard, we call that hypervigilance, and being startled by the smallest things. The nervous system just cannot calm down.
Now, timing is also a really big deal in getting a diagnosis. Typically, the symptoms have to show up within 6 months of the event, and they need to last for at least a solid month. But, and this is interesting, the guide notes there's also a late onset type, which can happen with people like soldiers, who are often trained to just push through trauma in the moment.
Okay, so we've got the 4 main pillars. But let's be real, people rarely walk into a doctor's office and describe those things perfectly. So what are the more subtle, indirect signs that a professional is actually trained to spot?
Right. Patients usually don't come in and say, "Hey doc, I think I have PTSD." They come in with other problems. So clinicians have to be detectives, really. They're trained to look for a whole bunch of clues that might point to an underlying trauma that the patient hasn't even connected the dots on yet. So what are they looking for? Well, it could be vague, stress-related issues, or a patient who just seems really quiet, withdrawn, avoidant. Persistent sleep problems? That is a huge red flag. They're also on the lookout for physical aches and pains that don't have a clear cause, or other conditions like anxiety, depression, or substance abuse, which very often go hand in hand with PTSD. And this is where the family doctor, the GP, becomes so important. They are the first line of defense. Their job isn't necessarily to treat the PTSD themselves, but to be the one who suspects it, who helps reduce the immediate stress for the patient and their family, and then makes that critical referral to a specialist who can help.
Okay, let's get to the most important part of this whole explainer. What can we do about it? The good news, and it is really good news, is that PTSD is absolutely treatable. So let's look at what those pathways to healing look like.
And on this, the clinical guidance could not be more clear. The number one, first-choice treatment is psychotherapy, specifically therapies that are trauma-focused. They have the most evidence by far. Medication is considered a supporting tool. It can be helpful alongside therapy to manage tough symptoms like sleep issues or that intense hyperarousal. But it is not the main event. Therapy is.
And it's really important to know, we're not just talking about any kind of talk therapy here. The guide points to very specific, evidence-based methods that are proven to be effective. They all have different names, but they share a common goal. They give the brain a structured, safe way to process the traumatic memory so it can finally be filed away as something that happened in the past instead of something that keeps hijacking the present.
Now, when we do talk about medication, the choices are also really specific. The guide recommends a certain type of antidepressant as the first option. But you know what's really fascinating? It's what they say not to use. Common anti-anxiety drugs, you might know them as benzos, are explicitly not recommended. The guide is very direct. There's just no evidence they're effective for the core symptoms of PTSD.
And finally, treatment isn't just what happens in the therapist's office or what's in a prescription bottle. Real, effective management is about creating a whole supportive environment for a person to heal in.
The absolute foundation of recovery is safety. That means creating a predictable, trusting relationship with the therapist. It also means taking practical steps, like reducing stress from the outside world. Maybe that's taking sick leave from work. It means checking for other physical injuries that could have happened at the same time, like a traumatic brain injury. And critically, it means getting the family involved and supported because they're on this journey too. So when you put it all together, we see PTSD is a clearly defined and, most importantly, a treatable condition. The biggest hurdle really is just recognizing it in the first place. And that leaves us with a final thought. Now that we understand what the professionals look for, how can we use that knowledge to become more aware of the science in ourselves, in our friends, in our communities, and help close that gap between suffering and healing?